Well, I'd like to welcome everybody to this week's webinar. It's great to see everyone. Glad everybody's doing well. Hopefully everybody is doing well. Um, I'm Bruce Rosenblatt with Senior Housing Solutions. And if you don't know, I am a senior housing advisor. I own a company called Senior Housing Solutions. And what I do is I help people with the decision process of moving to a senior living community. I have been in the business for over 30 years, and I'm very familiar with all the different options in town, and so I help people through this decision process. I also have developed a network of advisors who do similar to what I do in other cities. And so if you are thinking, or if you have somebody, a friend of yours or a family member that is thinking outside of the Southwest Florida, please reach out to me, because I do have advisors who are, that I have vetted, that I would feel comfortable referring. The other piece that I do is I try to be a resource for people. Education and being available to people no matter what services they need. So being a resource, and these webinars that I do, as people have been sharing with me, that I'm trying to educate people about the different choices that people have, and different things. And so I hope everybody's been enjoying these webinars. We're going to continue. I have a full slate for the remaining part of June as well as into July. Just kind of heads up, next week we have John Hoagland from Hoagland Family Hearing, and I know he's a good friend of myself and Adam's as well. And so he's going to really talk about how hearing loss and how you can improve your hearing, and it's going to be a very fascinating presentation. So I would encourage you to join us next week. So in this business, you meet people that are like-minded, and so I have met Adam Corcoran, who is the Director of Business Development for Golden Care. And Adam and I are good friends. We've known each other for many years. We are on different boards together, and we go to the same barber. So, but Adam, we work together. We're colleagues. We refer back and forth with one another, and I know Adam, feels very strongly. I believe he has a background in education, so his background is very similar to mine as far as educating people and giving people the knowledge that they can empower themselves. So it's my pleasure to introduce to you Adam Corcoran of Golden Care. And Adam, I'm going to let you take it from here.
Sure. First and foremost, Bruce, thank you for having me today. It means a lot, and your partnership, just supporting the community, educating the community. That's what we look to accomplish. So hello, everyone. I'm Adam Corcoran, Director of Business Development for Golden Care. Golden Care is a state licensed private duty home care agency covering Southwest Florida. We've been servicing our community for over 3.5 years, and we look to continue to support the community from years on forward. I've been in the industry for about 6 or 7 years, but a little bit about myself. I got into home care at a young age. My mom was the director of nursing for a home care agency in New Jersey, in Ocean County, New Jersey, where she took a small company kind of off the ground and grew to a very large company. But and if you asked me 10 years ago, would I be doing what I'm doing today, I'd probably tell you no way. Because I know what it takes to have a company, and it really comes down to a commitment. So mom was that nurse that jumped in a car and on a Saturday night and went out to a patient's home if a wound needed to be dressed or what have you. So although I don't discount my college education, I've learned a lot just at the dinner table, to be quite honest with you. It's been a great takeaway of being brought up in a home of a nurse. My grandmother was also a nurse as well. And at the young age of in my teens, I actually helped support care for my grandmother, as she lived right down the street from us. So Golden Care's goal is essentially to keep people healthy, maintain independence, wherever they call home. Okay, so maybe that might be a home environment, a single family home and gated community here in Southwest Florida, or maybe it's, help with one-on-one support in a senior living environment. So we hire certified nursing assistants and home health aides to maintain that independence, provide support with activities of daily living. So what I want to talk about a little bit today is more so our current environment. I've been getting a lot of questions of saying, like, how does home care fit in to the environment today with coronavirus and a pandemic? And believe it or not, it's more relevant than people think. When March came around, I'll kind of just talk about the timelines of things. March came around and it became very uncertain of what was going on, right? How this virus was going to impact not just our community, but our healthcare world. And most, people got pretty scared, to be quite honest with you. I looked at it as opportunity to continue to support. Okay, we're not going to just, shut down our doors and say, well, just because a virus is happening, we're not going to be able to help. I think now more than ever, people need us. And I'll give you a couple of specifics. All right. So once I started getting phone calls of reasons why someone's calling us, I said, I have to create some sort of education. And we came up with a flyer and it speaks to specific situations. Like, for instance, in Southwest Florida, it's a very seasonal area. Okay. And a lot of cases, mom and dad live here in Naples or Bonita, and, their family is afar. Okay. So the son and daughter might live up in Michigan, New Jersey, New York, the Midwest. And in some circumstances, when mom and dad or dad gets sick, the kids are able to jump on a plane and come down and help. That's not the case right now. Okay, there's a big time where people were not open to travel or they couldn't travel. So we started getting phone calls from families that are afar and saying, I can't get to see my mom, so I need your help. And so that was an opportunity for us to really look in and say, okay, how could we bridge that gap? We saw a lot of people being hospitalized and coming out of the hospital and maybe not having that support that they once had. We were getting phone calls for stuff that typically wasn't our normal scope of practice. I mean, we provide support with grocery shopping and doing laundry and, driving to appointments and stuff like that. That's part of our services. But typically people call us when they have greater needs. Now, with the barriers of not being able to get out to the grocery store or get supplies. So we were getting calls for a variety of different things that would be somewhat unnormal in our environment. So again, I looked at that as an opportunity to kind of continue and expand on that. The other thing is here in Florida, our elected surgeries kind of went shut down for a couple weeks, which means that these orthopedic doctors and some doctors are putting everything on hold. And then once they lifted that, we saw an influx of a lot of people getting the knee surgeries, the hip surgeries, rotator cuff surgeries. So we saw a lot of opportunity of post-operative care as well. And to be quite honest with you, the highest risk of infection besides coronavirus is in a skilled nursing facility for rehab. Now we put in this pandemic of coronavirus, and the numbers are saying that majority of the cases are with the older population in rehab facilities. So a lot of these elective surgeries, they're opting not to go to a rehab, which in a normal situation probably would be the best sense for them, but they're going directly home with home health and support through a company like us. So although we saw a decrease in a little bit in early March, I think we've seen greater opportunities throughout this whole situation. And it makes me proud because being able to help people is why we do what we do. And it's influential to say, we're giving those families peace of mind. We're giving that spouse peace of mind that their loved ones are being taken care of. And, scenarios, it's tricky though. It's a different environment. I'll tell you, to be honest. We see a lot of people who are discharging from the hospital that really don't have a lot of information. You take a normal hospitalization, someone's going in maybe for, common cold or pneumonia or what have you. In a normal circumstance, their spouse or daughter or son can go visit several times a day throughout the entire stay that they're at the hospitalization. That's not the case right now. So even if family is local and has the ability to support, those families aren't able to visit the hospital or the rehab facility or even the senior living community at all. So that's another opportunity that we saw, because a great deal of our clients actually live in assisted living or memory care. And that might be a surprise to some, but there is needs. And we'll talk a little bit about transitional care here in a little bit, but with families not being able to visit their loved ones in senior living communities, that causes somewhat of a concern. So I'll give you, for instance, we got a call from a wife who had a spouse that was in memory care, and she lived right down the street, and she visited him twice a day. So right after breakfast time and then right before bedtime, every day for 5-6 months that he's been there. And it was heart-wrenching because she's like, I've been going 3 weeks without being able to see my husband. So she's like, I know this sounds crazy, but I really need to hire you to kind of help be that connecting piece of the puzzle. So we were able to, put 4 hours a day going in right before bedtime, and we helped with Zoom calls and activities and had that additional oversight for the time being that really gave her peace of mind that, she had the level of care that was appropriate for him. So again, I know coronavirus has been challenging, and it has for a lot of people. But at the end of the day, I honestly think we as a community have to work together to provide that right level of care for that family. A lot of people ask, how does Bruce and I work together? And we work together actually really well. Some people will say that, Bruce is helping people move to assisted living, and Adam, you want to keep people at home. So how does that work? How do you guys work together? And as Bruce said, I've known Bruce for a very long time. We've become great friends. We've sat on boards together, but we've really found good opportunity. As I said, a lot of our clients actually work or support in assisted living communities. So I'm going to talk to you a little bit about transitional care. Transitional care into a senior living community is really important, actually. We found opportunities where if we knew someone was getting to a point where maybe home wasn't the best option for them, we would refer them to Bruce, and they would obviously do their due diligence to find the right place for them. We also saw that having us help with that transition has been equally as beneficial. And I'll tell you why. Moving someone into a new environment, whether you have dementia or any cognitive impairment at all or not, can be challenging, right? The unloading the boxes, getting acclimated to a new environment, meeting the new neighbors, understanding a little bit more about what that routine is, when's dining times, where do I go? So having that extra hands on to support with that, we've seen has been very beneficial. So when we see families that maybe be our current clients that we know that are transitioning into a senior living community, we ask them, would you be open to having our support throughout? And most times they do, because they want that connecting piece. They want that familiarity. Now, also for someone who isn't a current client of ours, but would like to entertain having that support, we look at those situations and say, maybe it makes most sense for us to start services a week or 2 weeks prior, acclimate our team, right, with that person who is transitioning in, and then they kind of develop that relationship. That relationship is super important. So when they do make that transition, they have that familiar face, every day, or, for the first week or so, to really help navigate through that new environment. We've seen great success. The other good thing about that is now they're considered a client of ours. Now, maybe we do transitional care for a week or 2 weeks, and every single person is different, so it's not cookie cutter. But then we say, okay, let's put services on hold, because we truly want that senior living community to take over and build that relationship with them. But the fact of the matter is they could put services on hold, and we can still can have that person as a client, just not actively providing support for them. So that down the road, 3, 4, or 5 months down the road, if something were to occur, we can jump right back in with that one-on-one support. And I think senior living communities appreciate that too, because let's just take, for instance, if someone were to go out to a hospital and then come back to that community, they might need some more attention. So we can jump right back in. Paperwork's already in place, consents are all in place, so it's a smoother transition. With coronavirus and making transitions, we've seen an increase of communities reaching out to us to be that level of support, more specifically due to the mandates that the state is requiring. So in a lot of scenarios, if someone's coming into a new community, they actually have to quarantine for some time. So whether I've seen as low as just 5-6 days, and some communities are mandating a 14-day quarantine. So a lot of communities want to have that one-on-one level of support, so we can come in and provide that level of assistance, and then again, help make that transition over to the staff of the senior living community. So there's a lot going on right now. I know it can be scary for some, but at the end of the day, home care is very relevant, very relevant.
Adam, I have a question for you, or can you talk about the differences between an agency and a registry?
Sure, absolutely. So I actually, and I'll put the form in the comments when you post this onto social media. I have a form that's called Choosing the Right Home Care Provider. It's an extremely helpful tool to when someone is looking at home care as an option, to really know what they're getting into. As I mentioned earlier, Golden Care is a state licensed home care agency. An agency is certified or licensed, bonded, and insured, and as an employer, okay, it's our responsibility to protect our clients and employees with the insurance, workers' compensation, the bond. That's our due diligence, okay? Along with being an agency, it's our obligation to supervise, train, make sure that our staff is up to date with their CEUs. And it's a higher level of vetting, okay? And really, it should be. You're entrusting someone to come into your loved one's home environment. You want to make sure that they're hiring the right people. So an agency does all that for you. The other models is a nurse registry, or you can hire privately. And I'll speak briefly on those two models. So a nurse registry is a licensed company here in the state of Florida. But a nurse registry has independent contractors. And what does that mean? So as Golden Care employs their employees, a nurse registry would have a pool of independent contractors. Now, that nurse registry might require those independent contractors to hold their own liability insurance, And they may or may not do a good job of keeping up on making sure that they have that. There are liabilities if they don't. Okay, so let's just say that that independent contractor slips and falls in someone's home. More than likely, they're going to take action against their homeowner's insurance. Or put a claim against it. The other thing is, I mean, I'm big on regulations. So I've done a lot of research and understanding when it comes to a nurse registry model, the supervision and management of care has to be done by that person or family. So where our responsibility as an agency is to have a structured team in our office to ensure that you have a client care, client relations coordinator, we have a life enrichment specialist, our whole scheduling team. That may not be the case with a nurse registry, right? You might not have that level of oversight. And again, every registry is a little bit different, but you just have to make sure you do your homework. Typically, nurse registries are going to be a couple dollars cheaper on the hour in most cases. We've actually seen in nowadays, our rates are pretty much right in line with the same. So really, you just have to ask the question when you're looking for support. Are you an agency or a registry? Are they employed by your company, or are they independent contractors? The third model would be to hire someone completely independent. Now, I know people have done that before and been successful. I also know that there's a lot of risks associated to that. I hear all the time, you know, my mom, they hired the checkout girl at Publix. And that might be great, but is she licensed? Does she have training? Does she have liability insurance? What vetting process did you do to ensure that that person, you know, isn't a criminal? You know, every single person that works either for an agency or a nurse registry actually has to have a level 2 background check in the state of Florida. So you do have that protection. But if you're hiring someone off of the street, or off of Craigslist or Facebook, or finding the girl at the supermarket, are they background checked? I mean, that's a big question. And then you go down the same risk, you know, similar risks that you look at in a nurse registry. If things start to go missing, you know, that person calls off. What's your level of backup? I did a seminar down in a country club in Naples a couple of years ago, actually now. And I was explaining the same exact scenario of, you know, agency versus registry versus independent contractor. And a woman asked, I like my presentations to be interactive. And so a woman, as I'm going through this whole scenario, stood up and said, "Can I just make a comment?" And I said, "Sure." I had no idea who she was. And I was kind of got nervous. And she said, "You know, I hired a lady who knew someone from her church, and for 14 months, she was amazing. She provided care for my husband. She was there every single day. She was timely. She was caring, compassionate." And I was like, "You're discrediting everything that I'm saying about the risks associated to that." I'm getting super nervous. And she said, "But wait, my husband became terminal, and they ended up having hospice services coming in. And that caregiver that they hired, that they did not really do much vetting at all, right? They just trusted that she was a great girl, you know, to really help out. And she was for 14 months, and she demonstrated that. So the gentleman became terminal very quickly, as we know could happen. And all of a sudden things started to change with that person, you know, showing up late, or, you know, taking a day off here and there. And then all of a sudden, you know, that family got hit with a ton of bricks because that caregiver stole over $50,000 from that home and fled out of state. So, and I don't say that to scare people. I say that because this is real scenarios. We hear about elder abuse on the news all the time. These are real life scenarios that happen to real people. And, you know, really without doing due diligence and having that level of vetting, it could happen anywhere, but more than likely it's going to happen when there's no oversight. So
Adam,
you do have options, but just know.
Adam, we have a question for you.
Sure.
The question is, what steps are taken to ensure that workers don't bring the virus from home to home?
Great question, and that's very relevant right now. So I can speak what we're doing for our internal process. I can't speak for every single company, obviously. But Golden Care, we are taking very serious measures when it comes to this virus. So we've actually been ahead of the game for quite some time. A little bit about our company. We have a sister company that is a Medicare certified agency here in town as well. So our owner was very diligent in making sure that we had the appropriate equipment, okay? Masks, gloves, hand sanitizers. We revisited our policies and procedures on hand washing. We actually use a platform that we tend to over communicate, which I appreciate. So every single day, our employees, before they clock in for a shift, they have to take a survey. And that survey asks them questions of, have they been exposed to anyone with symptoms, or have they traveled outside of their environment in the past X amount of days? So they have to take that survey every single day. If that survey comes back and the answer is yes to any of those questions, it comes to all of our administrators. So we know real time that that person might be a risk, and we would obviously pull them off of that assignment right away and quarantine them until they had 2 negative tests. We're going through a process right now. The state of Florida actually just released about 2 or 3 weeks ago that every single senior living community employee and rehab employee has to be tested, coronavirus tested, for every 14 days. That has not hit home health as of yet, but we are taking those same exact measures because we do a lot of work in senior living communities. So when we're providing that support for people in assisted living or memory care, we're ensuring that they already have negative testing. So when we talk about preventing risks of infection, it really comes down to having the appropriate equipment, hand washing, and we're not putting our employees at risk. Currently, and I don't think we'll really be in a position to accept anyone that is coronavirus positive. So there's a lot of steps that have to be taken to make sure that that is a very safe environment, but we want to protect everyone. We want to protect our employees. We want to protect our clients. So it definitely looks a lot different than it did 6-7 months ago.
Adam, so my other question to you is that, there's a lot of people on this webinar that, may not need home care right now, but maybe in the future, they may want to, they're kind of thinking along those lines. Do you do anything to sort of develop an interview or a profile with people, so then they, if they ever needed your services, you can go right to that file and you know who this person is and know that they have a little dog, etc.
Right. I appreciate you bringing that up because I would say home care is typically in crisis matter. And that's very true. I would say out of 10 phone calls, 8 or 9 of them are for people who have care needs within a couple days or right away. Very rarely do we get the phone call that someone's looking into it for the future, which I really hope people would consider. We like to look at home care proactively. So what that would look like is maybe you or your family member, your loved one, is at minimal risk right now, or you are independent, but you're just looking for planning, right? We always like the opportunity to get to know the person before we have to really jump in and support. So we have a program called Always There. Really is we ask people to take the opportunity to carve out maybe an hour to time where I would come visit, or we would do a Zoom call or just a conference call, and just to get to understand their, where they're at in their journey of aging. Okay. Where they live, who they live with, where's their support system? Do they have any pets? What types of medications do they take? Who are their doctors? These are all just basic things that we like to know, that we would gain that information upon admission anyhow. But the sooner we have that information on file, and we have a profile built out for you, down the road, if something were to happen where you have a immediate need, we already have that information about you. So we know that you have 3 cats. So of our employees that are allergic to cats, we're not going to send that person. Or if we know that you have a preference for, a specific type of caregiver that has a specific type of skill set, we already have that information. So I'll give you, for instance, just by a show of hands, right, on our Zoom call, who's planning for their next hospitalization? No one really, right? We don't want to think about the times that we're going to fall or get pneumonia or, have that time where we're going to have to be displaced out of our comfortable environment. But the reality is when you want to have peace of mind, knowing that you're already set up with a company that if and when you ever did need help, it's a phone call away. So we go through that kind of evaluation. As I said, it doesn't take much more than an hour. And we put all that information on file. We don't harass you. Okay. We don't call you every week and saying, is it time? No, maybe we'll check in every couple months. We might send you a birthday card or, a newsletter, but nothing to burden you. We just want to stay in touch. When that time comes, when you're unexpectedly hospitalized or had a couple of falls and you're like, okay, now's the time. We already have enough information that we can streamline the whole process and be more timely for you. It's very difficult. I got a call last night at 7:45 for someone who needed care last night. I said, that's a tall order. And I think about that situation. I'm like, if that person already had a pre-existing relationship with me or any home care agency, I would have been in position to be able to act much faster. So I ask you, what are you doing to protect yourself for the future situations? Planning is a big part. Bruce, just as well as I do, we talk about planning on a daily basis. And some of these conversations are hard to have, but at the end of the day, I think it's going to set you up for a better success.
Well, my saying that it's better to be 5 years too early rather than 5 minutes too late.
That's right.
And I would think, all the due diligence that people need to do to find a comfortable home healthcare agency, that's going to take a little time. Interviewing, you have to have a comfort level. And why not do that while you're able versus being in a reactive mode?
Correct. And in many cases, from when our people are acting in a very urgent matter, they're not making the most informed decisions. I usually get someone who's so frantic calling down the list that the hospital gave them, and they're saying, "What's your hourly rate? What's your hourly rate? What's your hourly rate?" And they just go down the list and just try to find the cheapest option. You pay for what you get, in most cases. So is that really you doing your due diligence? This isn't buying toilet paper at the grocery store. This is entrusting level of care for you or your loved one. You want to make sure you're making the best decision possible.
Can you give people an idea of what your rates are?
Sure, absolutely. So I'll speak specifically to Southwest Florida, but then I can talk on a national level. Here in Southwest Florida, you're going to see rates kind of fluctuate, to be quite honest with you. We've seen rates as low as $20 an hour all the way up to $29 an hour. I'm transparent in saying that we're right in the middle. We're $25 an hour, and that's most commonly what you're seeing, 24, 25, 26. That mid-20s is very common for a certified home care agency. Again, you can find someone on Facebook and Craigslist probably as low as $16, $17 an hour. But again, you have to know the risks associated to that. And a lot of companies have minimums, okay? And it's important to understand why. A lot of people say, well, what do you mean? You mean I have to have someone for 4 hours at a time? And yeah, in most cases, home care agencies have 3 or 4 hour minimums. And the reason behind that is really consistency. I when I get the phone call for someone who's like, I really don't know what I want, but we'll just call you like each week and tell you what we want that week. And I am very transparent in saying that's not how it really works, because what you're doing in that environment, although might be flexible for that person or family, is you're creating a very unstructured way of setting up care. You're creating a revolving door of multiple caregivers, multiple people that really doesn't serve a good purpose. In my opinion, actually, it's counterproductive. You take someone who has any cognitive impairment at all, and now you're bringing in new people every single day or every other day. It doesn't serve a good purpose. And I honestly think the support is not good. So we ask for some structure. Most companies will ask for 4-hour minimums, and some that now we're seeing a lot of people having weekly minimums as well. So.
That's good. Great, Adam. Really good insight. Anybody have any other questions for Adam? I'll mute you all.
I think I saw some things coming.
So Adam, if I wanted somebody who is, could prepare a certain type of ethnic food for me, am I able to be that specific on who I want? If I wanted a male caregiver versus a female caregiver, or somebody who could cook Jewish food for me, can I be that specific on who I want?
So when we do our assessments, it takes typically about 1.5 hours to 2 hours, sometimes as much as 3 hours. We ask a lot of questions, and some people will say, "Oh my gosh, like you're asking a lot," but we really have to, because, like, to your point, the more specific we get, the more better prepared we'll be. So when you're talking about ethnic foods, I have 135 employees. Okay, not every single one of them is going to be the best chef, which we get, but we have to know that's a big priority, right? So then when we go back to the drawing board, we talk with our internal team, say, okay, let's talk about what the skill set are so we can match make that person. So I would say, yes, we can certainly meet needs that are important. Now you're talking about a male. I'll be quite honest, males are hard to come by in our industry, but that's not to say that we can't. We probably have somewhere between 12 and 15% of our staff is men. But I will tell you, our men are outstanding. So we can never guarantee men just because of the shortage, but we absolutely do our best. And maybe it's not right away. Maybe it's, starting out with the care team that makes sense for that given time, and then introducing that male into the care plan. And do we get it right every single time? I would be a liar if I said that we did. Okay. And if any home care agency tells you that they're going to get it right every single time, they're probably lying too. Sometimes it takes a couple of days to really get in there and understand what that day-to-day is to truly find that right match. And that typically helps with a long-standing relationship.
Adam, I know I'm going to send people a recorded version of this webinar, but if people wanted to get a hold of you, how would they reach you?
Sure. So the best way is to call our office. Our number is 239-440-2900. You can visit us online at www.goldencarefl, as in Florida.com. And you can check out our Google reviews. We have some great families that have left some great reviews for us. The other thing I want to mention is we work very closely with long-term care insurance. Okay. I think I saw something come up in the chat box of, do we work with long-term care insurance? I would say 40% of our population that we care for is on claim with long-term care insurance. So I like to say that we specialize in it because I've done a lot of homework, and in the years that I've been in this industry, have worked very closely to help advocate for people who have policies to help protect them. And it's actually beneficial for people like you, Bruce, and I, there's future collaboration that we can work on together too, because a lot of people who are transitioning into a senior living community might want to utilize home care as an option to get through their elimination period. We could probably do a whole another webinar on long-term care insurance.
Sure we will.
Yep. Very cool.
Anybody have any questions? Bob, you have a question?
Yeah, I was wondering what turnover ratio might be for the people that work, your 185 or so employees that service clients. What kind of turnover ratio do you have?
Yeah, turnover ratio, and I've joined several seminars about turnover in the home care space, specifically for our region and also on a national level. I was actually at a national conference in Orlando last year. It's very high. It's very high as an industry. I think there's a lot of things that attribute to that. One being, depending on the market that you're operating in, us being a transient market, we're seeing up to 65% turnover. Another thing that is, I brought in a national speaker earlier this year to talk about the caregiver, not just caregiver turnover, but why caregivers are looking at other opportunities. My colleague just sent me an article yesterday. Target is increasing their hourly wage, and they're offering sign-on bonuses. So not only are we competing with other home care agencies or the nursing communities or the hospitals or the senior living communities for work, now we're competing with Starbucks and Target and Amazon. So I think this day and age, people are making more moves. Whereas you look 20, 30 years ago, people stayed at one company for 20, 30 years. And sadly, things are changing. Bobby, a follow-up question?
Yeah. Does your contract that you have with your clients, not us, does that permit us to, let's say we really like the person that's been dealing with us, and we want to hire them on as and take the burden of insurance risk and liability and all that stuff, and we wanted to hire them on.
Right.
Does your contract permit that kind of arrangement with some special accommodation for your company?
Sure, absolutely. And most commonly with all home care agencies, you have to understand, we've put in time, effort, monies, training, that whole scenario really is to retain our employees. So in most contracts, if someone is interested in looking at taking on that person as their own employee, they can do it. But in our contract, and I've seen other contracts, service agreements in my past as well, there is penalties associated to it. So it might be a monetary buyout, sometimes as high as $15,000. So again, do you have the option? Sure. You might just have to pay the cost. But you have to understand, even in doing that, you would absorb that cost, but then you become that employer. And if you're okay with taking on the risks of being their employer, I've done a lot of research, and I'm telling you right now, the IRS is cracking down on our industry because of the caregivers that are working privately under the table. It has to be a very clean arrangement. And then you also put yourself at risk in saying, if you invested the buyout cost, and then all of a sudden that person found a job at the hospital and they're leaving you, you're right back where you started,
Thanks.
Adam, Adam, are you all making any provisions or pre-planning for hurricanes?
Yeah, so every hurricane season, it's kind of 2020 has been interesting. We started this year and went through this whole pandemic, and then all of a sudden, oh, it's June, we're in hurricane season. Every year we do. So, I mean, at the end of the day, a reputable company has plans in place. I'm proud to say that our industry is audited every 2 years. ACA is our governing board. They were visiting with us last week for our biannual audit, and our emergency plan is up to date. We have plans in place. We know what could happen. I've done some research on articles of a very active hurricane season. I think we've really put ourselves in a position to be able to continue to support our surrounding community, our aging population through this season, really based off of the experience that we had with Hurricane Irma, which was an eye-opening experience for many people. But we were very successful in being able to roll out and continue care and prioritize our clients who needed care, who needed to get to shelters, who needed supplies. I was very proud of our team who stepped up during that time. Mm-hmm. Great question.
So anybody else have any questions?
I'm looking here in the chat. Linda asked if we interface with the VA. So that's a good question. The VA does support. Okay, so when you look at payer resources, there are some options with the VA. As of right now, Golden Care is not contracted with the VA program. I think there's only 3 or 4 local providers that are contracted. However, we do work with people who obtain aid in attendance. Okay, so that's an additional stipend onto an existing pension to help pay for care. We're going to be looking a lot closer at the VA contract to see if we can become one of their providers, because I think there's a lot of room for veterans that need support, and they're, obviously want to take advantage of the benefits that they offer.
Thank you.
So there's my friend Jack had a question for you, Adam. He says if he searches the internet for home care agencies in Naples, he doesn't see Golden Care in any list. And he's also curious whether you all, what Medicare pays for.
So I'll address the first one. We do not invest in any, pay-per-click advertising as of right now. More commonly, what you're going to see is, franchise models or corporate structures that have big budgets to be at the top of that Google ranking. If you type in Golden Care, Naples, Florida, I guarantee you will be the first to pop up, and you can read our 22, 23 positive 5-star reviews. So that just comes down to, we're trying to grow our business organically through word of mouth advertising and not dumping. We want you to use our company because we're a good option based off of, our reputation, not just because we paid a lot of money to be the first link on Google. Secondly, your question was in regards to what does Medicare cover? So another flyer I have actually speaks to that specifically. Medicare will only cover skilled clinical home health support. So what that looks like is if someone, let's just say, was in the hospital, now coming home after a hip surgery, all right? Medicare will cover a nurse to come to the home or a therapist to come to the home, and sometimes limited home health aides to come help with showering. But they're not going to cover for hourly support through a company like us. So that's why we do have a sister company, Preferred Care Home Health Services, that provide that clinical care, and we kind of bridge the gap. So we work hand in hand. I'll also post a flyer in the link that you post on social media about the differences of what Medicare covers and what it doesn't through like a company like ours. And Medicare every year keeps on saying, we're going to look closely at this, and we're going to start paying for home care. Don't hold your breath. Yeah, you got to be careful. Some of the Medicare Advantage plans, we're seeing a lot of people in like Ohio and the Midwest, a lot of Medicare Advantage plans, replacement plans, are actually paying for some hours per week of home care services. Here in Florida, I have not seen a successful rollout of Medicare or any Advantage plans actually pay for our type of services. Yeah.
Well, thank you, Adam. Thank you very much. And thank you for being part of this presentation. So I just want to, again, thank you, Adam. And Adam, if you'll send me those links, I'll forward those to everybody as well. I hope everybody's been enjoying these webinars. Next week, again, we have John Hodlund, who's an audiologist, a board certified audiologist, great guy, got lots of good stories, got a lot of great information to share. So I would encourage you all to be part of that. As always, if you have any senior housing questions, please reach out to me. This is what I do. This is my expertise. I've been doing this for quite a while, and reach out if you need anything. So be well, be safe, and we'll see you all next week.
Thanks, Bruce. Appreciate the opportunity.
Thanks, Adam.